All right, finishing up the topic of exercise testing, I want to touch on how we test flexibility and also balance. So, a little bit about flexibility. So, flexibility defined is just the ability to move a joint through its full range of motion. So, range of motion is just how many degrees you can actually move a joint. The importance of it, it facilitates movement and it may, and I put this in quotations, decrease incidence of injury. A lot of the evidence about flexibility decreasing the injury risk is anecdotal in nature. There's not a lot of scientific evidence on it, but nevertheless, it's probably not going to hurt your chances of getting injured. It's not going to increase your chances of getting injured. So a lot of people still recommend it as part of a light stretching, at least as a part of a warm up. So flexibility is going to depend on a lot of things. How distensible the joint capsule is, the temperature. Generally, warmer temperatures are going to lead to improved flexibility. Muscle viscosity plays a role, and also just the tightness of the tendons and ligaments that surround the joint. And just like strength, flexibility is specific to the joint that you're actually measuring at. So you could have very flexible, a lot of flexibility in some joints and not so much in others. So measuring flexibility, the best way to do it is directly, and that's where we use a goniometer. And I have a picture of a goniometer right here. A couple of them, and you can actually fit the goniometers with a digital device to measure the degrees if you want. But it's completely fine to use the old school method, just measuring the degrees on a standard goniometer. So in addition to that, there are several indirect ways to assess flexibility, and a lot of these are just field or laboratory tests that can be done. So you've all probably heard of the sit and reach test that can be done. It can be done in multiple ways. The traditional YMCA sit and reach test looks like this, where there are rulers or yardsticks placed on the ground, and you lean forward and see how far you can stretch, and you just measure the number of centimeters or inches that they can reach. You can also use a sit and reach box, which is generally preferred, where you don't reach down as much, and you just slide this little thing down, and it marks how far you can go. More recently, they're recommending a modified sit and reach that's called the back saver, and that's where you bend one leg like this. It's thought to be a little less stressful on your back. But again, this test, the sit and reach, is specific to lower back, your hip joint, and potentially hamstrings as well. So it's not a measure of overall whole body flexibility. It is specific to those joints involved, just like all the other tests. Other common field tests that are done: shoulder rotation test, where you see how close your hands can get together on a bar like this and still put it behind your back. And then total body rotation is where you just kind of twist and like the woman is doing here, and you move this little slider thing on this rack and see how far you can push it, starting in a standard position. So using a goniometer, like I said, is the best way. Here's some guidelines that are straight out of the ACSM guidelines text about it, but it's pretty simple. You have a fixed end of the goniometer and then a movable end, and what you set that up, and then the person moves at the joint, and you just measure the number of degrees. Uh, Generally, at least 3 times are recommended, and you just use the best score to give them some type of value for their flexibility, and you can actually compare that to norms. So common joints that are assessed with a goniometer, and we do have norms for these. So hip motion, we have extension, flexion, which you can see here at the top. So obviously this is the hip extension, this is the hip flexion. You can see a little goniometer drawn in there. Knee extension and flexion. So you can see the setup here. They're using the goniometer, and then the extension, and then also the flexion. Then ankle plantar and dorsiflexion. So you can see here, there's a goniometer that they're kind of marking right here. Uh, Plantar flexion and then dorsiflexion, you can get in degrees. And then shoulder flexion, you can do like this. Preferred way to do it is lying down like this. And then we have elbow also extension and flexion that you can do. And as I was saying, these are the norms. So you can see they're kind of stratified by age. and then also sex. So these are the major ones, and I listed most of these in that previous slide. But those are the ones that are commonly done, and these are the norm. So it gives you an idea of how you are related to what's expected for your age and sex. All right, moving on to balance. So balance, enhanced balance, importance of it. It can maximize performance depending on what kind of activities you're doing. Definitely improves the quality of life. Prevents injury potentially, and especially as you get older, decreases the risk of falling. And then also, it could potentially enhance recovery from any injury that might be present. So, ways to assess balance, we can do it statically, which basically is standing upright and no movement involved, and just maintaining an upright posture. And then dynamically, the ability to just maintain stability while you're actually moving in some fashion. So direct measures, which can be really expensive, usually involve some type of force plate, and that's what you can see in this top picture. This individual is standing on force plate, and that actually is a system by the company Biodex that actually gives a readout of how much sway is going on as the person tries to stand there. So obviously, this is a pretty expensive method. Uh, and then we also have more indirect measures, which come down to like field and laboratory tests. So there's one called the Y balance test, which is more static. Balance error scoring system, which is also static, and then the timed up and go, which is very dynamic and generally applied to older adults. So, a couple of examples of these. So, the balance error scoring system, or the BESS. Basically, you're going to stand, and they're standing. You can stand on like a foam plate or a hard surface, and it's generally recommended that you do both. But in this case, there's basically three stances, and so a person stands there and tries to maintain their balance, and an examiner counts the number of times they mess up, basically. And so things that they could do to mess up would be they're supposed to have their eyes closed, so opening their eyes, moving their hands off of their hips, kind of stepping or stumbling, kind of bending over, so excessive hip flexion, anything like that. So you mark down every error they do, and they're supposed to hold it for 20 seconds. You do it three times for each side, and then basically the score is how many errors that you made in that 20-second time. And so, pretty standard test to do, but again, it's static balance. And these are some norms that I found. There aren't any norms in the ACSM guidelines, so I pulled these from elsewhere. But you can kind of see based on age and sex, kind of where the values are. And then the Y balance test, you can do it in a couple of ways, but the traditional way actually involves using a device that looks like this. So a person stands there, 1 foot there, and then they're going to push in three different directions and three times each. So they'll stand on 1 foot and then kind of push this little pad forward as far as they can without losing their balance, and you just record the distance. So you can do it three times forward or anterior, and then you go posterior or lateral in one direction. You're pushing it that way with that other foot, and then posterior medial, which is going back in this direction. And then you change feet, put the other foot in the center foot platform, and do the other side as well. So you'll get a score for each one, a best score for 3 trials in each direction, and then you basically sum those values up. Then lastly, timed up and go. Like I mentioned earlier, this is generally used for older adults, but it's basically a test of dynamic balance and somewhat functional ability. So a person starts out sitting in a chair, they stand up, walk 10 feet around either a cone or a piece of tape on the floor, and then walk back, and then sit back down. And the time to do that is just recorded as the score. So it's actually that simple. So stand up, walk 10 feet, turn around, go back, sit back down, and the time that it takes to do that is reported as the score. So these are some reference values that are found. Again, none of these are found in the ACSM guidelines, so I just pulled these down from a research study that was done. That gives you an idea of what's considered normal based on age. And notice how the ages are all older. They're all over 60. So this would not be much of a challenge for someone who's younger and pretty functional.